Hello again. I'm Thomas Hammond from TraXel and hope you're doing well. I'm checking in here from the TraXel team in San Diego. We stay isolated and safe, as hopefully you are, and wanted to chat with you a little bit about the updates of changes in healthcare and healthcare technology, and how they impact patients with chronic diseases and especially multiple sclerosis. Now, there's on the one hand that the COVID virus is especially scary for people with pre-existing conditions, people who are taking immunosuppressants. So I trust that you are well informed enough to stay isolated and safe and look after your own health. But while you're isolated, you then are struggling obviously with how do you get healthcare? How do you get access to healthcare? So there's good news on that front, is that at least the federal government has responded to some of those needs and made it easier for doctors and healthcare providers to exchange information with their patients. So if you contact your healthcare providers, please note that as of now, under a special extraordinary exemption, healthcare providers are allowed to use video systems to chat with patients, even if they are not under technical HIPAA provisions. When we first started TraXel, one of the ideas we had is connect patients simply and easy with their healthcare providers. There were some limitations on that based on current laws. While they are not completely stripped and voided, currently under this situation that we are facing, they are put on hold. The other issue that has been put on hold are licensure restrictions that often limit patients and their providers to one state. So especially if you're living in a rural area, you may be having doctors just across state line that you would like to seek for healthcare advice. And just until very recently, those healthcare providers were not allowed to telephonic or video message you and give you healthcare recommendations. Good news is also that has been put on hold. So we're trying to make our TraXel users, our community, as well informed as possible. And so a couple of the most important updates are now: your healthcare providers are allowed to chat with you via video, even if the video system is not technically HIPAA compliant. Now, everybody's asked to use encrypted software and Zoom, other systems such as FaceTime, WhatsApp can be used. And the other big news is that healthcare providers and their patients are allowed to communicate across state lines. If you wonder how is this so significant, just an example, there are areas in California where the nearest town to the healthcare provider may be in Nevada or in Arizona. And just until recently, those patients in, let's say, Arizona needed to seek healthcare providers possibly much further away in their own state than just across the state line. That was because healthcare providers' license was limited to the state they are practicing in, which meant that the patient and the healthcare provider had to be in the same state. If a healthcare provider wanted to give advice to a patient just across state line, that healthcare provider would have also had to hold privileging and licensure in that other state. Now, those state licensures are cumbersome, often expensive, and difficult to maintain. So a lot of doctors didn't have licensure in multiple states. This really changes now everything, especially for those of you who live out in more rural areas. The other limitation that I've talked about is this non-HIPAA compliant video and telephonic communication. Now, privacy is super important, and we do not want our information, especially healthcare information, to be out in the open and leak. But there are many systems such as I just mentioned, WhatsApp, Zoom, and FaceTime, they are end-to-end encrypted. Not all are HIPAA compliant, but provide the safety that in this current crisis will allow you to chat with your doctors and healthcare providers. So this, at least for now, should help a lot. Now, we at TraXel are building a platform that will be going forward and more robustly connect patients and their healthcare providers. But for now, this is a big relief. Please make sure that you and your healthcare providers know about these changes and utilize them as much as possible. So hopefully you can stay safe, stay away from the virus, and hopefully at the end, we're all going to be better off in a new healthcare system that is much more open to technology and much better connected. TraXel is ideally suited to help with that. So please stay on our socials, stay engaged with our website. We're posting new information relevant to the MS population almost every day. Just want to let you know that while we are social isolated, such as yourself, we're still there for you and working hard to finding solutions to make the everyday lives of patients with MS better. The way we do this, we're staying safe, as hopefully you are, and I hope to see you soon.